I want to carry this ultrasound scan. I tend to scan from this side of it, but there are a few problems with it and it usually hurts your back. So the first thing to do is bring your scanner over. I'll raise the bed up. I'm just moving up. So first thing we'll do is whenever you get your probe off, if the patient is, if I'm going around to do the 4-chamber view, I need to obviously lean over from this side of the bed. And if I'm leaning over like this and I'm trying to look at the screen, it does hurt your back after a while, especially when you're training and taking time to get good images. So the other option is to try to save your back. You end up leaning like this, but then you're turning around to the screen and trying to save your images, and then you lose position. So what I find helpful is actually get a bit closer to the patient, get your knee right up. It's comfortable for the patient that you can lean against me, and then I can lean over. So you're leaning over here. I can bring the machine right over to me, so I'm taking the pressure off my back, and I can see the screen easily here. But again, what I always like to do is, if you've got a lever on it, bring it right over so that I can see and save my images, and then I'm not having to rotate and put pressure on my back so much. So some people prefer scanning from the right side of the bed and using your left hand, especially if you're left-handed. You might feel it's more comfortable, or if you've been trained to scan from this side. Personally, I find it difficult. So one of the things to do again is make sure you've got the bed at the appropriate height. If it's too low, you're scanning down like this and still hurting your back because you're bending over. So if you bring the bed up higher, bed's going up. Oops, no, bed's going up. And then this is much better position for me to do the scan with my left hand. It also avoids the how close you have to get to the patient. Whenever you scan from the other side of the bed, obviously you have to lean right over and be quite close contact with the patient, so it avoids having to be that close to patients. The other advantage that you can do from this side of the bed is actually use a chair. So you can sit quite comfortably and scan from this side of the bed and take all the pressure off your back.